Now, the head of the World Health Organization has declared the monkeypox outbreak a global health emergency.
Yes, and despite the World Health Organization committee being unable to come to a consensus, they've declared the emergency anyway as the tie-breaking vote.
Now, let's talk to Professor Azeem Majeed, who's Professor of Primary Care and Public Health at Imperial College London. Morning to you. Good to see you. Should we be concerned about this?
No, I don't think so. I think the actions that WHO recommend countries take are already in place in the UK. So, for example, we're increasing public awareness of monkeypox, increasing work amongst NHS staff. We're testing people who might have the infection. We're tracing contacts, offering advice and vaccination if that's needed. And we're also offering vaccinations to high-risk groups as well. So the measures that WHO want in place are actually already here in the UK, and those are working quite well, I think, at the moment.
How is monkeypox spread?
So it's spread through close contacts, like, say, COVID, which can spread very easily, say, in a room, so one person can affect many others. With monkeypox, it really requires close contact. So, shaking hands, close contact during sex, for example. So it can't really spread just by being close to someone, but not actually in physical contact with that person.
Nasty, is it? What I can't understand is, obviously you don't want to catch anything. You don't want a condition, a disease to spread, and yet there's not really any treatment, is it? Doesn't it just go away after a few weeks?
Yeah, in most cases, in the current outbreak, it has resolved without any complications. There have been a few deaths, around 5 globally, so a very, very low death rate, about 1 in 3,000 cases. For most people, it's generally not a pleasant illness, but it will resolve after a few weeks without any major complications.
So why would the World Health Organization declare a global emergency?
I think it's a good question. So I think the fact committee was split shows there was debate about this question. So I think the concern numbers are increasing. It is spreading across many countries. And also for the first time, we're seeing outbreaks that are spreading without contact with animals. So this is something we haven't really seen before in the past very much. So I think they're concerned it may become more prevalent across the world, more common. So they're trying to act early to prevent that happening.